Today, we're diving into a topic that affects millions of people worldwide: depression. In this video, we'll explore what depression is, the symptoms to look out for, why it occurs, preventive measures, treatment options, alternative treatments. Depression is more than just feeling sad or having a bad day. It's a serious mental health condition that affects a person's thoughts, feelings, and behaviors. According to the World Health Organization, about 5% of adults globally suffer from depression, with rates often higher in developed countries. For example, in the United States, nearly 8% of adults experience depression annually. Depression manifests in various forms, including major depressive disorder, MDD, which is characterized by prolonged periods of sadness and loss of interest, and persistent depressive disorder, dysthymia, which is a chronic, milder form of depression that lasts for at least 2 years. Other forms include bipolar disorder, where depression alternates with periods of mania, and seasonal affective disorder, SAD, which typically occurs during the winter months when daylight hours are shorter. Recognizing the symptoms of depression is crucial for early intervention. Here are some key symptoms to be aware of. Persistent sadness. This goes beyond temporary feelings of sadness. It's a deep sense of emptiness or despair that lasts most of the day, nearly every day, for at least 2 weeks. Loss of interest. Activities that once brought joy, such as hobbies, social interactions, or even sex, no longer hold any appeal. Changes in appetite and sleep patterns. Some people might eat more and gain weight, while others eat less and lose weight. Similarly, some might experience insomnia, while others sleep excessively. Fatigue and low energy. Even small tasks can require a lot of effort, and people with depression often feel tired despite not having engaged in strenuous activities. Difficulty concentrating. This can make it hard to focus on tasks, make decisions, or remember details. Feelings of hopelessness, guilt, or worthlessness. These thoughts are pervasive and often irrational, contributing to the overall sense of despair. Physical symptoms. These can include unexplained aches and pains, such as headaches or stomach issues, that do not have a clear physical cause, thoughts of death or suicide. In severe cases, individuals may have thoughts of ending their life or engaging in self-harm. Immediate professional help is crucial in these instances. The causes of depression are complex and multifaceted. Some key factors include genetic factors. Research indicates that individuals with a family history of depression are more likely to experience it themselves. Studies have identified certain genes that may be linked to depression, although the exact mechanisms are not fully understood. Biological factors. Depression is associated with imbalances in neurotransmitters in the brain, such as serotonin, dopamine, and norepinephrine. These chemicals play a crucial role in regulating mood, and their imbalance can contribute to depressive symptoms. Environmental factors. Life events such as the death of a loved one, divorce, or significant financial problems can trigger depression. Long-term stress, such as being in an abusive relationship or a high-pressure job, can also contribute. Psychological factors. People with certain personality traits, such as low self-esteem, perfectionism, or a tendency towards negative thinking, are more vulnerable to depression. Childhood trauma or abuse can also increase the risk. Medical conditions. Chronic illnesses like diabetes, heart disease, or multiple sclerosis can increase the risk of depression. Hormonal changes, such as those during pregnancy or menopause, can also play a role. While we cannot entirely prevent depression, certain lifestyle changes can significantly reduce the risk. Healthy diet. Consuming a balanced diet rich in fruits, vegetables, lean proteins, and whole grains supports overall health and can improve mood. Some studies suggest that omega-3 fatty acids, found in fish and flax seeds, may also help reduce depression. Regular physical activity. Exercise releases endorphins, which are natural mood lifters. Activities such as walking, jogging, yoga, or even dancing can help reduce stress and improve mental health. Adequate sleep. Ensuring 7 to 9 hours of quality sleep each night is crucial for maintaining mental health. Establishing a regular sleep routine and creating a restful sleep environment can help. Stress management. Techniques such as mindfulness, meditation, or yoga can be effective in managing stress. These practices help calm the mind, reduce anxiety, and improve overall well-being. Social connections. Building and maintaining strong relationships can provide support and reduce feelings of isolation. Engaging in social activities and seeking support from friends and family can be protective factors. Early intervention. Seeking help at the first signs of depression can prevent it from worsening. Regular mental health checkups and being open about mental health can aid in early detection and treatment. Treating depression typically involves a combination of approaches tailored to the individual's needs. Medication, antidepressants such as SSRIs, selective serotonin reuptake inhibitors, SNRIs, serotonin norepinephrine reuptake inhibitors, and tricyclic antidepressants can help correct chemical imbalances in the brain. It's important to work with a healthcare provider to find the right medication and dosage. Psychotherapy. Cognitive behavioral therapy, CBT, helps change negative thinking patterns and behaviors. Other therapies include interpersonal therapy, IPT, which focuses on improving relationships, and psychodynamic therapy, which explores underlying psychological causes. Lifestyle modifications. Regular exercise, a healthy diet, and proper sleep can all support mental health. Incorporating these habits into daily life can enhance the effectiveness of other treatments. Support groups. Sharing experiences with others who understand can provide comfort and insight. Support groups offer a sense of community and can be a valuable part of the treatment process. Electroconvulsive therapy, ECT. In severe cases, ECT can be effective when other treatments have failed. ECT involves administering a brief electrical stimulation to the brain while the patient is under anesthesia. It has been shown to be particularly effective for severe depression and treatment-resistant depression. The effectiveness of treatment varies, and what works for one person might not work for another, which is why a personalized approach is essential. It's important to work closely with healthcare providers to develop a comprehensive treatment plan. In addition to conventional treatments, some individuals find relief through alternative therapies. Acupuncture. This traditional Chinese medicine practice involves inserting thin needles into specific points on the body. Some studies suggest it can help alleviate symptoms of depression by promoting the release of endorphins and other mood-enhancing chemicals. Yoga and meditation. These practices can reduce stress and improve mental well-being. Yoga combines physical postures, breathing exercises, and meditation. while meditation involves focusing the mind and reducing negative thoughts. Herbal supplements. St. John's wort has been used to treat mild to moderate depression, but it can interact with other medications. It's important to consult with a healthcare professional before use. Light therapy, particularly effective for seasonal affective disorder, SAD. Light therapy involves exposure to bright light that mimics natural sunlight. This can help regulate mood and improve symptoms of depression. Alternative treatments should be used in conjunction with, not as a replacement for, conventional treatments. Always consult with healthcare professionals before starting any alternative treatments to ensure they're safe and appropriate for your specific situation. Depression is a complex and serious condition, but it's important to remember that help is available. By understanding the nature of depression, recognizing its symptoms, and exploring various treatment options, we can support ourselves and those around us in managing this condition effectively. Remember, seeking help is a sign of strength, not weakness. If you or someone you know is struggling with depression, don't hesitate to seek professional help. Thank you for watching, and don't forget to like, share, and subscribe for more insightful videos.